My name is Ann Vandemar, and this presentation contains an overview of the PTSD Toolkit for Nurses. PTSD Toolkit for Nurses was developed by the American Nurses Foundation and Penn Nursing Science with Wolter and Kluwer and is managed by Lippincott. It is available for download on Android devices through Google Play and through Apple iTunes for iPhone, iPod, and iPod Touch devices. Do we all know how to recognize the symptoms of PTSD and the many ways it manifests itself? Some things we may see our patients struggling with in the clinical setting are anger, anxiety, depression, extreme tension, emotional lability, insomnia, and even suicidal ideation. As some of us are new nurses, myself included, how well are we equipped to assist patients experiencing these difficulties? So, what exactly is the PTSD Toolkit? The PTSD Toolkit app is an e-learning resource for nurses to support the treatments of clients suffering from the symptoms of post-traumatic stress disorder. The subscription is free for 1 year and continued use requires a fee after that. With a year's worth of practicing assessments and applying your new knowledge in the clinical setting, you might be an expert on aiding clients with their stress disorder issues and no longer require an app for assistance. The app contains simulations to assess correct responses to client situations based on real-life case studies and supplies the user with resources and interventions which have been researched and are evidence-based. Not only is PTSD a widespread problem for our serving and returning military members, but members of the general public suffer from this debilitating syndrome due to any number of factors and causes. As well as military combat, PTSD can result from sexual assault, physical and emotional abuse, experiencing a natural disaster, experiencing sudden loss, being the victim of a crime, and suffering disfigurement from accidents. With the ease of usability and extreme portability, the app should be very helpful to nurses whom are unfamiliar with approaches to PTSD and require practice to gain knowledge and confidence when caring for their patients. The more knowledge we attain, the better we can serve the people we care for, and possibly even ourselves. Thank you for your attention, and thank you for all you do for the patients you care for.